Yat Eshe Joel Begay Yenshe. Just introduce myself in my native language, Navajo, saying, hello, my name is Joel. As a first-generation Native student, I often find myself being the trailblazer, especially being the only one who has a college degree and now pursuing a master's degree. So Shipwreck is a very isolated rural community in the Four Corners of New Mexico. Having grown up there, I just remember seeing my grandfather travel to the hospital, the local hospital, so that he could get a refill of his insulin. I often asked my grandma, I was like, why is Grandpa taking so long? And she was like, oh, it's the Indian Health Service. Like, it's not surprising, it's nothing new. I would say that was the seed in me wanting to pursue the health profession. I personally wanted to make a difference, either work for the Indian Health Service and improve the patient care experience, or do research and inform the Indian Health Service. The reason for me pursuing public health and epidemiology is exploring what risk factors or what protective factors or what characteristics in general make this particular population susceptible or vulnerable to certain types of disease. I've always been involved since even high school, I'd say, having my hand in multiple pots and just being involved, and I like to know what's going on campus. In terms of the university at large, serve on a couple of different organizations. One is the Native American Student Association. Every week I facilitate a meeting with other Native students on campus, just discussing either current events that are happening on campus. Now I'm working with them to discuss like how we can improve the Michigan experience for Native students. In terms of the school at large, involved with the SPHDEI committee. And I've enjoyed doing that. I've enjoyed working with other student representatives. I've enjoyed working with other faculty and staff representatives, getting to know them. I have this support group and everybody's rooting for me, and that's something that I want other students to experience when they come here, especially students who are coming from racial ethnic minority groups or underserved populations. When they're in Michigan, I want them to feel like they belong. I'm definitely interested in medical school. I'm also very interested in PhD program. I think at this point, I know that an MPH is not my terminal degree. I think the best case scenario would have to be an MD PhD route, becoming like a physician scientist, and it's what I envision when I think about that, when I reflect on my grandfather's experience.